Well, more people are talking about prostate cancer and wishing the former president well. President Joe Biden has been diagnosed with an aggressive form of prostate cancer that has spread to his bones. The statement says, while this is a more aggressive form of the disease, the cancer appears to be hormone sensitive, allowing for effective management. The 82-year-old former president and his family are now reviewing treatment options with doctors. All right, to take a closer look at prostate cancer and what men should be doing to prevent this from happening, I am joined by Dr. Kavin Johnson, an internist. Dr. Johnson, thank you so much for being here.
Thank you.
A lot of people, this is once again, and we had just talked about prostate cancer recently. You had a work session for men on that, a health event. And with the president's diagnosis, of course, more people are focused on this once again. And one of the things that came out, Dr. Johnson, was this Gleason score of 9. What does that mean?
Very good. You must have a biopsy to diagnose prostate cancer. Biopsy, just a needle that grabs a piece of the tissue. So once prostate cancer is diagnosed, the question is, how aggressive is the cancer? The Gleason score will help answer this question. If the cells of the prostate look fairly normal, that tends to be a more slow-growing tumor. Fairly normal means from 1 to 6.
1 to 6 is normal.
1 to 6 is normal.
And it goes from 1 to 10, right?
Correct.
Okay.
When you get up to 8 to 10, the cells look so abnormal, and that's called an aggressive cancer. It is likely to spread fairly quickly.
Okay, so then one of the things too, and that's what we're talking about, that's why it's considered this aggressive form, again, because it is at that high Gleason level,
That's
that
correct.
score.
That's correct.
So one of the things though, I guess doctors are saying is a bit of good news, and if you'll explain this, it's hormone sensitive,
Yes.
which allows for effective management. Tell us about that. What does it mean, hormone sensitive?
Lots of tissues in our body are sensitive to certain hormones, but the prostate gland in particular is sensitive to the hormone testosterone, which men, a lot of tissues in the body are sensitive to testosterone. But the thing is, the prostate cancer tends to grow, it tends to spread the more testosterone is in the body. So the fact that it's testosterone sensitive means we can treat it now. We can give medicines that deprive the tumor of testosterone. The tumor essentially starves us because we're depriving it of testosterone. Now it won't cure it, but it could slow down the growth and allow us to treat with other medicines.
So then that basically, like you said, it's slowing down that spread and that growth there.
Definitely.
And one of the other thing though we talked about there is when we talked about the metastasis, and so the bone, and like what that means though, and if you could explain a little bit more about that when you hear that term and you've seen that in reporting about this case.
Definitely. That's one of the characteristics of many cancers. Metastasis just mean they spread. Our bodies form a very orderly structure. The heart cells do not move into the lung cells. The toenail cells do not move into the knee cells. The cells follow order, not with cancer. Cancer cells will spread to the adjacent organ. They will skip all your organs and go up to your brain. That's what metastasis is.
And is that why it could be so dangerous, right?
Very dangerous.
Right? Because of that.
That's right. That's right.
You know, one of the things too is a lot of men are watching this, and the question we have to answer is, we wish the former president well, is men are saying, what do I need to be doing? What do I need to be looking for? And that's something we need to answer too. One of the things is that the former president went, he said, after increased urinary symptoms. So what does that look like? I mean, you understand, like going to the bathroom more, but how excessive is it? What does that look like? And when should a man watching right now be really concerned about, I need to go to the doctor and get tested for this?
Very good. That's a very good question. By the time prostate cancer produces symptoms, and it usually doesn't produce symptoms, by the time it produces symptoms, I can almost guarantee you it's an advanced form of cancer, just like the president has. What do I mean by that? Prostate cancer tends not to produce symptoms in the early phases. By the time you get symptoms, that's an advanced cancer. What are the symptoms though? It tends to be excessive urination is one. By the same token, it can be cessation of urination. I mean, it can either stop or it can flow heavy. Another bad symptom is blood in the urine or blood in the semen or so. These are symptoms of prostate cancer. You don't want to wait until you have symptoms. You want to do the screening test and all before you get symptoms.
Okay, so again, like it could be excessive or it could almost cease.
That's correct.
And then, like you said, that blood in the urine. And if you see those symptoms, then you need to immediately pick up the phone and call your doctor.
Definitely.
And so for any man out here listening to that, or a wife, let your husband know that. So that is so important. I think to try to wrap this up though, we know that it's an aggressive form.
Yeah.
We know, we've talked about that, but doctors have also, in the reports I've read, said that this isn't necessarily in about 30 seconds or less a death sentence, that there is hope as they look at treatment. Just really quickly talk about that and then the treatment that could be available.
Very quickly. Prostate cancer is not a death sentence. As a matter of fact, if you diagnose prostate cancer early, before there's any symptoms, there's a 95% cure rate. You're not going to die of prostate cancer, 95% cure rate. Now, if you do develop prostate cancer, there's very effective treatment. Prostatectomy, remove the prostate gland, take it out.
Is that an option possibly here, like in this case when it's this aggressive?
No.
Okay, that's what I was saying.
No.
Yeah.
With the president, it's so widespread now.
That it's going to have to be a...
And remember, the treatment is depriving the tumor of the hormone.
Of the hormone there, so it can't spread.
That's correct. Okay. That's correct.
Okay, so some very good information there. Dr. Johnson, as always, I appreciate you coming on to talk about this topic. It's so important, and once again, getting the attention from a lot of men right now.
Definitely.
To pay attention. Thank you so much.